Joining me in the studio to discuss the viral hepatitis disease is the founder, Health Drive Nigeria, Adewunmi Adegbola. Thank you so much for joining us on World Now.
Thank you so much for the opportunity.
Right, it's one thing to be aware that you have a disease or you have a virus, another thing for you to be able to seek medical care. But let's talk about first the awareness in the world, particularly in Nigeria. How much would you say people are aware about what is called hepatitis in the first instance? Okay,
thank you very much for the question. So if I would scrutinize the current not noise, but the current awareness or sensitization of hepatitis in the country, I think we are doing very well in that aspect. I think over the past few years, we've been able to raise serious awareness campaigns about hepatitis, about viral hepatitis across various parts of the country, even to the most remote aspects of the country. I mean, you would expect, you wouldn't expect certain people from certain places to tell you about hepatitis, and wow, they would really sit you down and educate you about what they think they know about hepatitis. Yeah, so if we should scrutinize the awareness strategies that have been implemented for the past few years, I think we have done very well. However, I must say that we have had a number of setbacks too, because I mean, for a country with one of the highest prevalence of hepatitis B in the world and the highest in sub-Saharan Africa, I mean, we should have gone past so many stages. We should have taken several strides ahead than so many other countries. And then the stage that we are at now, we shouldn't be here. But I mean, it's also best that I say that we've done fine. We're doing fine currently.
Quite interesting. So talk to us about the causes of this virus. What exactly is this hepatitis? We've got 5 variants, A, B, C, D, and E, right? Yes. So what exactly causes it? And talk to us about what it means to have hepatitis.
Okay, so hepatitis comes from two words, coined from 2 words, hepatos and itis. The hepatos means the liver, itis means an inflammation. So there are 2 categories of causes of hepatitis. We have the non-viral cause, we have the viral cause. The viral hepatitis is the one that is caused by 5 strains of viruses: hepatitis A, hepatitis B, C, D, and E. Then we have the non-viral hepatitis. That one is usually due to drug overdose, toxin ingestion, excessive alcohol intake, and excessive fat buildup in the liver. Yeah, so those are the non-viral causes of hepatitis. So, but the one that is of essence to us is the viral hepatitis. And in these 5 types of viral hepatitis, the ones that are very more important is the hepatitis B and hepatitis C. And then I would say the reason why they are very important, before I go back to a little more on what hepatitis is. Now, hepatitis B has no cure, but it has vaccines. And hepatitis C can be cured. It can be cured. I mean, there are medications that once the person is placed on, the person would use them, and then it offers about 95% certainty that the virus would clear off from the system. That is for hepatitis C. Hepatitis B doesn't have a cure, can only be managed, but there is the vaccine. And so we find out that Nigeria has very high prevalence of hepatitis B, particularly such that if you count about 10 people, you expect to see 1 person to be a chronic carrier of hepatitis B.
All right, let me quickly button, because we're pressed for time, very quickly. So how would you know you're suffering from hepatitis?
Okay.
Do you get screened, the kind of vaccine that you get, and the signs and symptoms to watch out for?
Very important. So the first signs that most people present with is a yellowish discoloration of their eyeballs, of the white part of the eye. So we call it jaundice.
Jaundice.
Yeah.
Okay.
So jaundice essentially signifies that there's something affecting the liver.
The jaundice is the yellowish coloring of
the eye. Right. Then some other people would complain of abdominal pain around the site of the liver.
Okay.
Some people would complain of vomiting. Some people's stool color will become pale. The urine will become more darkened in color. However, I must also say that hepatitis B can also be asymptomatic. Okay. Depends on the stage that it is in. If it is in the acute stage, the person would experience all of these symptoms. And once it progresses to the chronic stage, it may remain asymptomatic. That means it won't show any symptom for a long period of time.
And it can be contagious.
Yes. But when the next time symptoms starts presenting, there's already liver decompensation, and then it's already a very bad stage.
All right, we'll see how Nigerians, become more aware, because that's the reason why we're having this conversation. For Nigerians to be aware and get screened, going to hospitals closer to them, they can actually get screened and get cured, get treated. That's the word.
Get managed.
Managed.
Yes, and once they are certain that they've tested negative, they must pursue after taking the 3-dose complete vaccine.
Makes sense. Well, because we're pressed for time, thank you very kindly. The founder, the viral hepatitis disease founder, Health Drive Nigeria, Adewunmi Adegbola, thank you so much.
Thank you so much. Thank you so much.